So you might be wondering about how an EMDR session actually goes. So EMDR is a protocol, and it consistently will go through 8 phases. Now that might occur all in one session, although not usually. It might be over many sessions. So the first phase is history taking. The EMDR therapist will take a good history to determine, where the traumas are, what the client's experience is, etc. Then the second phase follows on that. Based on what was found, we prepare the client. That's phase 2. So a lot of that is developing resources that can be of use if the activation or the distress of thinking about it gets to be a little bit too much. And those resources can also be used by the client in between sessions, so it's very handy that way. Phase 3 is assessing the target memory. So with the client, I decide, okay, what memory are we going to specifically use EMDR on? And as we assess that, I will tease out what was the negative cognition or the negative belief, the thought about that the client was having. We would also tease out what emotionally it was like, different sensations in the body, what that was like. We want a real comprehensive assessment of what that memory is, because as we do the EMDR, we may go down these different channels of experience. We're going to just look at the feeling part, for example, or we're just going to look at the body part. So we will have a real comprehensive view of the target memory. Then we get into the part that you may know about, the desensitization part. So here we're using what's called bilateral stimulation. And that's often, we think of it with eye movements. That's what most people think of when they think of EMDR. And that is one way of doing this bilateral stimulation. Other ways include, tapping on alternate sides of the body. You can't see my knees, but I'm tapping alternately on my knees right now. There can also be like a headset with alternating tones in the ears. All of those are serving to stimulate the brain in making sense of this memory. And there again are different theories about this bilateral stimulation. Why does it work? The theory that I particularly like is the one that what we're doing is through BLS, through the bilateral stimulation, is we're stimulating what happens during REM sleep, the rapid eye movement aspect of sleep. That's when negative things that happen to you during the day are processed by the brain. So as we do this alternate tapping or moving the eyes across the midline, we're stimulating the two hemispheres, the right and left hemisphere of the brain, to alternately fire, which is what is happening during REM sleep. I like that theory. That kind of works for me. But again, we don't really know why this eye movement, bilateral stimulation seems to help the process, but it does. Okay, back to the phases. So that was desensitization. We work with the memory until it gets down to 0 level of distress as we think about it. Something that we use what's called a SUD scale, a subjective units of disturbance scale. And that's a 0 to 10 scale. I might start at 5 or 6, and I want it to get down to 0. There's no distress as I think about this now. And that's all done through these very short sets of bilateral stimulation as the client is thinking about that aspect of the target memory. So that's desensitization. The next phase, the 5th phase, is installation. So this is when we pair that memory with a new life-giving belief. So if my negative belief about the event was, I'm not safe, the new life-giving belief might be, I am safe, I can take care of myself, something like that. And there's all sorts of, there's no one set negative cognition, there's no one set positive cognition. We're just looking to kind of boil it down and see what the brain kind of attached to this memory, and then kind of what the opposite would be. So that's the installation phase. With very short BLS, we install this new life-giving belief. The 6th phase is body scan. And so what I would do as the therapist is I would ask you as the client to think about this formerly traumatic memory. And as you think about it, just think about it and then scan your body from head to toe and tell me if there is any sensation that's coming up anywhere. They might have a good sensation that's coming up. That's okay. I'm looking for anything that's still distressing. And then we would go back to phase 4 and then desensitize that. So that 4 through 7 phase, those, what are that, 3 phases, we might go through a number of times just to make sure we're clearing out all the traumatic aspects of that memory. Then we have closure, so I make sure that the client is in a good place, that they're ready to go home, leave my office without distress. I might remind them about those resources that we installed earlier in phase 2. And then finally, there's reevaluation. When the client comes back the next week, I will make sure to connect with the client and specifically ask, do you remember that memory that we were working with last time? And I will ask them to bring that memory up again and to see if it's held, if it's still feeling like zero distress. So that's the 8 phases of the EMDR protocol. There could be a lot more to say about that, but that's it in a nutshell.